Does your pet have any difficulty in climbing stairs? Difficulty in getting up or lying down? Don't scroll back. Your pet may be having a hip dysplasia. Hello, I'm Dr. Sri Lakshmi M. Nair, Consultant Surgeon, Cochin Pet Hospital. Today I will be talking about one of the most common but manageable condition of your furry friends, hip dysplasia. Hip dysplasia is a developmental orthopedic disorder of the hip joint that fails to form properly. Hip joint is actually a ball and socket joint in which the socket is formed by the C-shaped acetabulum and the ball is formed by the femur head, and a snugly fitting ball and socket joint will help in the movement of the joint in all possible directions. In case of a dysplastic dog, the joint is misaligned, causing increased laxity that could lead to cartilage damage, pain, inflammation, and eventually to arthritis. Hip dysplasia is a highly heritable trait that can be transferred from a parent to offspring. It also has some environmental and lifestyle factors like overfeeding during puppy phase, obesity, neutering at a very early stage, high impact exercise before the growth plates of the dogs are completely formed, and also some nutritional condition like calcium phosphorus imbalance. Most commonly, hip dysplasia is being reported in medium to giant breeds of dogs, which include German Shepherds, Labrador Retrievers, Rottweilers, Saint Bernard, Golden Retrievers, and Bulldogs. Small dogs can also be affected with milder symptoms. Main signs that you will notice if your pet is having a bad hip includes difficulty in getting up or lying down, difficulty in climbing stairs or running or jumping, pain on palpation of hip region, gradual decrease in the muscle mass, especially in the hind limbs, and also they will be having a stiffening of the limb, especially after a long exercise or after rest. Diagnosis involves physical examination and certain orthopedic tests like Ortolani sign, and also a radiograph of the pelvic region to assess the joint alignment and arthritis. Treatment mainly depends upon the stage of the hip dysplasia. In case of mild and moderate cases, we can go for non-surgical treatments, which include the weight reduction, that is very crucial, and also painkillers and joint supports, and rehabilitation exercises like physiotherapy and hydrotherapy. In severe cases or cases that are not responding to the medical therapy, surgery is the ultimate option, in which we have certain procedures like pubic symphysiodesis that is done in very young animals. We can go for femoral head ostectomy, in which the femur head is removed, that is mainly done in small to medium breeds. And in case of very severe hip dysplasia, total hip replacement is a golden option. Can we prevent hip dysplasia? Yes, of course. Selective breeding, controlled exercise during growth phase of the puppy, and avoiding overfeeding and ideal weight management can help in preventing hip dysplasia to an extent. So by early diagnosis, appropriate treatment and responsible care, your pet can have a healthy and happy life even though they are having a bad hip. So it's on your hands. Thank you.